courtroom, we don't use profanity, but if you have some words that you would like to say, I would like to give you the opportunity to say them.
I would ask you to, as part of this sentencing, to grant me 5 minutes in a locked room with this demon.
That is not how
Yes or no?
No, sir, I can't.
Would you give me 1 minute?
That's not how our legal system.
Well, I'm going to have to get something.
This is Larry Nassar, a once renowned athletic trainer who's treated thousands of elite gymnasts, mostly young girls training to be Olympic medal winners. For 30 years, Larry appeared as a professional to his colleagues and friends, but to his patients, he was a recurring nightmare that they were forced to relive every week on his stretch table. But these horrors wouldn't remain a secret forever, leaving hundreds of parents to deal with the fact that they unknowingly left their daughters in the hands of a predator.
It's you, the patient, and the spirit above, and it's this triangle pattern, and you have to get into that so that, because you don't want the bad stuff to come back into you, because then you get all bad. You got to be able to pass it.
Your body, would you touch
your
the
ear would be, if like this would be up towards the back, and this would be up towards the pubic symphysis.
Would you have any reason to touch her breast?
During the summer of 2015, 15-year-old Maggie Nichols, a U.S. national team gymnast and future world champion medalist, began experiencing back pain during a team summer camp. This wasn't an uncommon issue among elite gymnasts, and like many others, she was immediately referred to Dr. Larry Nassar. Dr. Nassar was considered one of the best in his field and had joined the U.S. gymnastics team as an athletic trainer in 1986, later becoming the team's head doctor after receiving his osteopathic degree. By 2015, he was simultaneously employed at U.S. Gymnastics, Michigan State University, Twistars USA Gymnastic Club, in Dimondale, Michigan, and Holt High School. So when Maggie was referred to him, she was completely confident that she was receiving the best care possible. But that idea quickly changed after her first few visits. In a letter Maggie later wrote to USA Gymnastics leadership, she described the first incident where Dr. Nassar took her into the training room, closed the door, and closed the blinds. She says, "At the time I thought it was kind of weird, but figured it must be okay. But then he started touching me in places I really didn't think he should. And that was only the beginning. Over the summer, the abuse only increased in frequency and aggression until finally, nearing the end of camp, Maggie couldn't take it anymore and told her coach about the misconduct. With her coach's support, she then wrote a letter to USA Gymnastics, and to her relief, her cries didn't fall on deaf ears. The head coordinator subsequently fired Dr. Nassar and took her complaint to the FBI, who then did a deep dive into Dr. Nassar's past and found some rather nasty skeletons. They learned that by that point, Dr. Nassar maintained his position as an athletic doctor for multiple organizations. It wasn't until the third student, MSU graduate Amanda Tomashow, made her report in 2014 that the university finally brought Dr. Nassar in to thoroughly investigate the matter. At the time of this never-before-seen interrogation, Dr. Nassar was 51 years old.
So basically what I'd like to start is what you already know. So why don't we start with that, because it sounds like there's been some conversations that have already taken place. So I'd like to know what you know.
What I was told was that, the patient was concerned that I was inappropriately touching her and didn't understand why. You know,
Okay.
He was, touching me in my private areas, and she didn't understand why. And those are two things that confuse me, because I do this on a regular basis. This is a treatment that I lecture on. I lecture on not only here at Michigan State to the fellows and residents and medical students, but to national organizations, international. I was the keynote guest speaker in Australia to the Australian Olympic Sports Medicine for this very technique. They gave me 2 hours to lecture on it. That's why I wanted to show you the videos, because there's no question I was touching her in private areas. That's what I do. I mean, but and I have stayed off the EMR. Do you know what EMR is?
No.
Electronic medical records,
Okay.
So that's like her chart.
Okay.
So I have stayed out of her chart.
Okay.
So I don't want to.
Since she came in.
Yeah,
Okay.
because I don't want to be like, oh, he doctored or whatever. So it should stay in there even that, I talked about this process. For me, I'm the type of doctor that spends, believe it or not, 30 minutes is the quickest appointment that you're going to have with me.
Okay.
It's 30 to 60 minutes, okay, because I do a lot of hands-on and I do a lot of mentoring. I do a lot of talking, okay? So, in her situation, that's why I'm beating myself up. I'm like, where did I go wrong? How did I not know that she was uncomfortable? That's the bizarre thing to me. Okay. It doesn't, that's why I'm like, what signs was I missing?
So that's what we're here for today, obviously, right?
Yeah.
So two sides to every story.
Right. What didn't I feel or perceive that she was feeling that I didn't get? Because if you touch someone wrong, they should tighten up. If you touch someone, you know, and this is what I lecture on too. It's like if you do something that's inappropriate, their body reflexively is going to respond. And I didn't sense anything like. I'm known for this.
All
You
right.
want me to? You know what I mean? And her body, you know, he picked me, okay, because that's my area, and I know how to. I can show you the stuff, but that's why I'm like, you know, because I tell people the touch is a personal thing, but there's a difference between palpation and caressing. You know what I mean? There's a total different, like, I tell a story, this is a true story, about when I was dating in medical school. And the reason why I went to DO school was for the hands-on stuff. And it ended shortly thereafter because we'd be intimate together, and she'd say, "You're palpating again," because I'm like, "But I can fix this." You know what I mean? And so I was like, you know, so I was more in tune, and that's how I've made my reputation, is very in tune to the person's body, okay? And that's what makes me the doctor that I am, okay? And so that's why I'm like, how the heck did I miss any signals? That's number one. Number two is also like, why, I don't get it. Why didn't she say something if she was feeling violated in any way, shape, and form? There was no communication.
Okay.
And that's why I'm like, what? Am I blind? Am I deaf? Didn't I hear or see anything? And she never, and she felt better. My understanding was when she was done that, yeah, because when I'm working on people, it's like, okay, how's it feel now? Number one, number two, what feels better? You know what I mean? And the pain was going away. She was getting better. And so if I'm resolving a problem and in constant communication with the patient talking, I don't get why she just didn't come out and say something. Okay? So those were my frustrations that I'm going over, because I obviously, if this happens once, it could happen again. I've been doing this for 15 years or whatever, and, you know, so wake up, you know, have you gotten too comfortable? Are you too relaxed about it? And I'm like...
At this point, Larry has been talking incessantly for 5 minutes straight. This behavior, referred to as over-explaining, is often done in an attempt to relieve stress and uncomfortable feelings, as well as give the listener the sense that the speaker is being open and honest. But in the process of doing so, the amount of irrelevant information and detail that's thrown in often has the opposite effect of making the speaker appear anxious, desperate, and dishonest.
What I try and do is gain confidence in a person, and then I help them, you know, because I always tell people there's physical injury and there's mental injury, and so much of it is more. I get referred all the time, people who have pain, that comes to me, their pain goes away. One of the biggest differences, I talk to them.
According to the first victim to come forward, Maggie Nichols, that's not at all what Dr. Nassar was like. Maggie would later describe her sessions with Dr. Nassar in an interview, explaining that he performed the treatments without gloves, without anyone else in the room, and without explaining the reasoning behind his methods. Numerous other victims mirrored her experience, saying that he didn't speak much during sessions unless it was to ask the patient if the procedure felt good.
But it's like, what the heck, you know? So I'm trying to think to myself, you really screwed up because you got into her, you broke into a space that she didn't want you to break into. You know, from my thought is from a mental standpoint, that then clicked off, well, maybe this wasn't a therapeutic or medical touch.
Right, which that definitely could be part of the reason why she thinks and why she's reporting what she is, which that is a portion. Or how did they find out?
The dean found out through the university, and so then the dean called down Jeff on Friday, or Thursday, Friday, one of those days. And so then Jeff came into the office of the dean at 7:30 in the morning. So I think it was Friday.
This past Friday?
Right.
Okay.
Right. And then the dean called me down Friday afternoon.
Okay.
Okay.
So Dr. Coleman was the one that first initially met with you.
Right.
So what did he say? And obviously there was the issue of the Instagram picture. What else did he tell you?
That she felt violated, you know, that I was doing, like I touched her breast and that I moved her underwear out of the way, you know, and I'm like, yeah, you know, I do that all the time, you know, and he said that he tried to explain to her too that, because I've taught Jeff, Dr. Coleman, how to do this stuff, you know, so he was like, but he said, because she said, Jeff said also she didn't want to make a big deal out of it, but Jeff said, because you're talking to me, I will move this forward because that's what I have to do. Because the rib problem, you know what I mean, I can fix their rib, but if I can't, a lot of times you can't use the shoulder. There's myofascial techniques, you know. I can fix their rib by having my hand on their bottom area, and I can fix their rib by, you know, from above, okay? There's just myofascial techniques, but it's medical. That's the problem. Like, how did she not?
So those would be some of the things we work through, right? So what may be helpful is if we start off with the videos.
Yeah.
That way you can show me, and then that way, and then what I'll probably have you do, if you don't mind, if they're not too long, and you can email them to me.
Oh, I got Dropbox.
Oh, perfect.
So look, let's go back in time. Okay. So this was like my first video that I ever made of this. It was made on a VHS tape.
Oh, Lord,
okay?
yeah. We're going way back.
Yeah, okay. Her parents are in the room, you know, and I wanted to give this lecture. So she volunteered. It's the first time I ever met her, okay? And she had see her chest movement, you know, so that's her range of motion right now, okay? So this is what I do. So she had physical therapy, 6 months of physical therapy. Okay, she'd been resting, you know, and they're like, okay, let's go see this doctor in Lansing. They came. Okay, so I'm doing the palpation of this part, but let me just go forward here. But look at the range of motion just from that. Okay, remember the range of motion was here.
Yeah.
Okay, and then I worked the fascia up the rest of her back. Okay, so she came in with a hamstring problem. Okay, but so where am I working? You see what I'm saying? I always tell people, it's like from your ponytail to your big toe, okay? Now, for 6 months, and now look at this range of motion, one treatment, okay? And that's where she couldn't get for 6 months, okay? You can see that it basically doubled her range of motion without even starting. Now I'm starting to do a little bit of stretching. That's the end point. You can tell when her body language is, you know? So that was like, okay, back then, I was thinking I was treating like the operator internist. I was trying to figure it out. Okay, the way that I first started working in this area was a gymnast had a hamstring problem and said they weren't getting better, same type of situation, and she was guiding me. And she was like taking my hand, and I'm right in her vaginal area, and she said, that's it. And all of a sudden, with my hand there, her range of motion doubled. You know, I'm like, what the frick did I just do? And so I did all this research, and that's how I became known for this, because I did all this research to try and figure it out. And I met with Dr. Greenman, who was he's passed away now, but he wrote the book on osteopathic manual medicine, principles of manual medicine. And he's like, I think you're doing more sacral tuberous and pelvic floor as opposed to operator interns, you know. So anyways, so that's why this is like, okay, that was the beginning. You can see how long ago that is all the time, and send them to, like, everyone leaves instead of paper, they leave a video on their phone.
Okay.
Okay, like if I wanted to go see a therapist or a doctor in a different area. So these people came up from, here we go.
Larry continued to divulge how he first concocted his sick medical explanation for abusing the trust of dozens of young girls. He goes on to descriptively explain how he disguised the abuse as pelvic floor exercises and suggested that these treatments were the cure for all lower body pains.
Where I come across, so I'm on the pubic symphysis, okay? And my hand's supporting the pubic symphysis in the front. In the front,
yeah.
Okay, I mean, yeah, I'm touching her areas, you know what I mean? That's reality, you know what I mean? That's... Sometimes I actually have to grab right here to apply that treatment process. Okay, so that is, now what, that's showing like hand placement, but what you can do with that, here's like IT band, pelvic floor, let me go up to here's like ribs, I think.
Okay, ready?
So now we're going to work just update it again. Outside up, because she has that butt head connection where she had the pain when she flexed her neck. So I'm going to check her here now. So my other hand you can't see, but it's in the inner rectovaginal area. So working half of the spine. Oh wait, okay, this would be testing her. Okay, so listen to what she's saying. Now, again, I'm going to bring her leg slightly out. She's saying it now. Push on the tush. I'm going to bring her leg slightly out. Go back further. Okay, now, again, I'm going to bring her leg slightly out. Go back further. This pain. See, this is what I want to hear you say. Pain, yes, pain, yes. Did you hear that? Just briefly. That's what I'm doing up. So where's her pain? Is there pain? Is there pain? Is there pain? She had pain the whole way up, okay? And now I put my hand to the ischial rectal fossa for the sacral tuberous ligament. No. So the pain goes away. Okay. You see what I'm saying? All the way up. Just by putting pressure on the sacral tuberous ligament now, her paraspinal muscle And that's what I've been doing with her, is like, does it hurt now? Does it hurt now? And I
Okay.
changed from those different hand positions. Pain doesn't hurt? Okay, so I'll take a deep breath, and then I hold it and work it out, so that's what I'm getting at, is like, I get her in a position that doesn't hurt, the pain's going away, and I'm talking the whole time. That's when I'm like, if I put her in a position that made the pain go away, and my hand is down there, there's no question about it.
Right, obviously I can see that.
Why? But it's a conversation too, you know what I mean? So she's going to be sitting on my hand. Now, I didn't do this with her, but I'm just showing you that, I do this in so many different positions. I do it standing too, okay? So now, she's legit sitting on my hand, okay? Coming up, so bone to sit bone.
Yeah.
So my fingers are on the inside of that, between the two sit bones, pulling this way, okay? Change my position. And then I actually send them home with exercises.
That's what I was going to ask. So then what is...
She sits on her hand and she does some exercises. So let's, and then standing, do I have the one in here? No, I bet you that's just in the...
So then do you tailor the exercises they need to do depending on positionally where...
I have one patient that has to come in, and she comes up, and it's hers both sides. So she has to take both hands and push up. And it's the only, she's had pain for a year. Okay, and since I've been showing her how to do it, she goes home, does it, and she's treating herself, and she's back to doing gymnastics now. But it's because of all these nerves that pass through here too. Anyway. So this is oh no, this is an older. The videos aren't connected. This is all from where I found the research was in with Fleming. He did a lot of research on pregnant ladies. Okay, and so I used to joke that, I took what they do on pregnant ladies and converted it to my athletes, because I work with gymnasts, dancers, and figure skaters. That's like 80%, 90% of all my patients. They're all hyperflexible.
Right.
What happens when you're pregnant? Relaxin comes out in your pelvis, and you get all these problems because of the pelvis relaxing to make room. So it's like, okay, that was, so the research that was done on pregnant ladies, with, following this all stuff, that's what Fleming's, it's in this textbook called Movement Stability and Low Back Pain, okay? And so we're trying to create stability. So it'll morph, it'll make sense to you as I go through it. But anyways, these are from his textbook, showing you how through that, this is not just me being crazy man, this is
Right.
textbooks,
Nothing you pulled out of the air.
Right, exactly, or in this case, out of my ass, okay, if you want to put it. But do you see how that goes? It's like, it's through. And so this treatment on her, and that's her range of motion. 3 days working on her at the gymnastics camp at our National Team Training Center, doing those techniques that you saw, and that's her range of motion. After 3-4 months of not being able to raise her leg up, okay? So, that's why it's very powerful. It makes huge differences, okay?
You want to make sure that you stay off of the rectal area, and of course stay lateral to the labia. If you get too close to the rectal area, of course they can get more skin irritation.
Okay, so you're coming right where
Right,
this. Okay, yeah. I'm not saying I didn't touch her there. I purposefully touched her there. Okay, that's the, So this was all like sacral tubers, and over time, and I'll just go. Yeah, there you go. The PP problem is a don't ask, don't tell issue, because we literally have to do like PP interventions at times because the little one has the PP problem and we got to talk to him about it. But okay, so this is like, because she actually hurt her hamstring up high, but she's like her hoo-ha, So she who must not be named, it's like I try and been educating people about these techniques, It's like everyone can't even say the word vagina, It's like, hello, you're medical professionals, Like I've sent people for intravaginal pelvic floor work to Sparrow Hospital. Sometimes you actually have to go intravaginal, too, for this stuff. And so, anyway, so I'm going through the anatomy of this stuff and trying to explain how the muscles, like I've had kids actually strain these individual muscles that I found from physical exam, and people are like, you're full of crap. I do an MRI, they sprain that muscle. I know this area, it's whatever. That's MRI. So what we try and do is we actually teach them to use their pelvic floor muscles, because if they use their pelvic floor muscles right, it actually increases their core stability. So it's when I'm in the pelvic floor area for this obturator and sacrotuberous ligament, you can't help but affect the pelvic floor. And the pelvic floor is known to actually, if you have this more stable use of your pelvic floor, it actually increases your core stability. So I tell people the core to the core is the floor. Start with the core by using your floor. Okay, so I'm trying to educate people on how to use the floor, and because that's what I figure I'm doing a lot of times is even though I'm there, I'm affecting the floor. And if I can get the floor to contract well, then I can get their their back muscles to work properly. Okay, so I talk about Kegel muscle. There's another one. Oh man, pediatric. I don't think that's has it at the end. This is another lecture this is the American Osteopathic Academy of Sports Medicine. It's the national sports medicine, like all the doctors of sports medicine doctors in the country. There's 2 more gymnasts that I had done it on too, and look at the range of motion afterwards. But anyway, so understanding the biomechanics of a single ligament makes a big difference. There's more that you'll see in the Dropbox.
Okay.
You'll see, I mean, I'm pretty graphic in the videos. Okay, and
Which
the
is
ones
obviously going to be helpful to the investigation.
And the other videos actually talk about, and that's I know they're on there. This is starting to irritate me just a little bit because I'm like, where the heck did I put them? Okay, Larry, bear with me.
No, you're fine.
But that's why I'm like, you know, I'm like, I do this. This is what I do. Why didn't I get the idea that she was feeling? You know, because I have to feel. I mean, like I do this on minors. You know what I mean, with their parent in the room, of course. But you have to be able to communicate. You have to be able to sense what the heck is going on, and why I didn't get that feeling from her is beyond me. And why did. And that's a question, I guess, that I can't answer because I'm not talking with her. But she did not vocalize anything to me that she was feeling offended. If anything, like I said, she was feeling like I was, yes, you know, I feel better. Okay, so that's why I'm like, if she's feeling better, what tipped her off to start thinking like, what the heck is this guy doing?
Dr. Nassar repeatedly comes back to the fact that the victim didn't voice her discomfort to him at the time, a common excuse given by predators. Victims of SA almost never directly confront their abusers. According to the National DV Hotline, the main reasons for this are the fear of being judged or not believed, fear of retaliation and going nowhere with their careers, and fear of feeling responsible, or that speaking up can lead to direct physical harm. This information tells us that failure to announce the abuse is not sufficient evidence that it didn't occur.
Yeah, if you can't find him now, that's okay. You know,
Okay.
it's
Go ahead. I can look while you're talking more. You know.
So
for questions.
when Dr. Kogan initially talked to you about this, so it seems like there was some time that went by from when he initially talked to you to when you were talked to again.
Mm-hmm.
When he initially talked to you and you guys had your conversation, what was the resolution or outcome of that conversation? So he tells you, hey, you know, she comes in here.
Right. I wasn't that worried about it. I mean, at that point, because he had said he explained it to her, and she didn't want to make a big deal of it. Was his words.
Okay.
You know what I mean? But he said he had to move it up the chain. You know
And
what I
then
mean?
he
So
explained the procedure to her when you say he explained
he
it to her?
explained it to her. I can't
Okay.
talk for him.
No,
but
I'm just curious if
saying
he
that's
told
what
you.
He said is that I tried to explain to her what you do. You know what I mean?
Okay.
And so those were his words, you know what I mean, or paraphrasing because I can't remember word
No,
for
that's
word
okay.
for it. You know, and she didn't want to make a big deal of it. And so those were the 3 things was that I remember from our conversation or 4 things was, it was after the Instagram picture and the moving of the underwear and moving of her breast, and because I was treating her ribs area, and then that she didn't want to make a big deal of it, but she thought she needed to talk to Jeff about it. And then Jeff saying that, you know, appreciate what you're telling me, so I will move this up. Actually, then make it up the chain. And the dean called in Jeff Friday morning. That's what's like, okay, so obviously she's making more of a deal of it. You know what I mean? Than not wanting to make a big deal of it. And I told Jeff at that time, I said, if she felt that way, I would encourage her to say things. You know, if she were to talk to me, you know, to say that some doctor did something, I said, you need to discuss this. You know what I mean? Because that's what I am, more of the patient advocate than anything else. It's my role. That's me. I don't know how else to say it. It's like me to do this stuff and to be able to do this stuff for so long. If you don't have patient confidence and patient trust, you'd have been having my ass in here how many times?
Right.
Okay? Okay, especially when I'm doing this on 10-year-olds, 12-year-olds, okay, with their parents there. But I'm obviously doing a doggone good job explaining things, okay, because what? You know
Yes,
what I mean?
that was going to be one of my questions, obviously. So there's never been any complaints that you're aware of prior to this one? And obviously you're videotaping things here, you're doing
Right.
lectures.
Well, this has been going on for forever, you know what I mean? Like, not forever, but the videos, you can see I've been videoing and changing and adapting, so I keep,
Yeah.
so that it's transforming, you know, from being just the operator internist to sacrotuberous to pelvic floor, you know what I mean? So all of that is the fulmination, the end point. I guess I can't find it.
No, that's okay. Don't worry about it.
But you want to see the ones with the, and listen to the words that I'm saying too.
Notice how Dr. Nassar very skillfully dodged the question of whether or not there were any prior reports against him. As we know, 2 MSU students before this have come forward with allegations, but by that point the police department in Twistar's gym had also received reports of misconduct from multiple victims.
That is, what communication did I miss that she was trying to tell me? Okay, did she say anything about verbalizing that I feel uncomfortable or anything like that? Because if she did, I didn't hear it. I didn't hear
So
it.
those are some of the things that I'll go over with you. I can
Okay,
go over
that's
in very
Well,
fine
come on.
detail
Right.
into what she said. So I'm not going to hide anything from you.
Right,
There's not
right.
going to be any secrets. I'll go
Right.
over all that stuff with you.
Okay.
I just wanted to know kind of what you knew up front, and then obviously I wanted to see the videos because that, what I'm seeing in these videos is basically very similar to what she is
It
telling me
should be, 'cause
happened.
that's what I do.
Yep. So that is why I wanted to see those first to say, okay, are we on the same page? Are we talking about the same thing from the get-go?
Right,
Which
right.
we are talking about the same
Right,
thing by
okay.
seeing those. So it'll be very important for me to get those videos,
Yeah,
and especially the ones, if you have ones in more detail,
Yeah,
that you
yeah.
said are a little
The
more
ones I
graphic.
sent to the whatchamacallit, to Romania.
Okay.
You know, so those were just done for 2013 of European, so last summer. I totally, I don't know how else to say it, but I'm totally taken by surprise, but at the same time feel like crap that someone would feel that I was doing something inappropriate to them. Because this is how I make my living. This is what I do. I've helped scores of people by doing these personal issues.
Which is
okay?
good to hear. It's, you know, it's good to hear that you feel bad that she feels that
Well,
way.
yeah, because I feel like this little deviant, you know what I mean? And that's not right. And that's not wrong. Do you know how quickly that would spread like wildfire across? I mean, out.
Right,
This is my
right.
27th year with the team, you know what I mean, or whatever, since 1986. I've been with the
Yeah,
national team. And I'm telling you, those kids, it would go boom, chuck, boom, chuck, boom, chuck, chuck. You know what I mean? Like, no question about it, okay? And that's what I'm saying is that there has to be a way that a person's able to disconnect, okay? If you don't disconnect, then when you're in that area, you have to be helping, you have to be doing therapeutic touch, not any other touch, because that sensations can be relayed through your hands. Persons can tell, you know what I mean? And it's like, how did I miss that signal that she felt that I was doing it inappropriately? Was I really that off that day or what? You know, that's my issue, is and it's hard because it was so long ago, you know what I mean? But it's what I do all the time. So was I tired? I'm like, okay, did I get to sleep that night? You know what I mean? I'm just trying to figure out, was I off? Was I said I wasn't sick? You know what I mean? I only get 5 hours of sleep usually a night anyways, you know, but that's normal. Like, did I get less than that night? You know, what made me out of sync? What made me not be able to recognize that I was making a patient uncomfortable, okay?
So generally, do they verbalize that, or a combination thereof?
There has been a few times where that has been brought up, okay? And in each and every time there was sexual abuse.
Okay.
So that's what I'm saying, is when they're uncomfortable like that, there's been 3 cases, and all 3 of them were sexually abused, okay? So that's why I'm like, yeah, okay? That's why I'm like, okay, is there something more? What am I missing? Because that's what I'm thinking all the time, okay? If someone's tensing up or having an issue with this, my first inclination is, were they ever sexually abused?
Right.
So I'm like, how did I, if for God help me, she's never been, you know, sexually abused, but say if she was, that's my job. Why would I miss that? Because then it's my job to bring help to that. You see what I'm saying? So where am I losing it, that if she, God forbid, had been, that I would have missed that cue, because then it's like, okay, boom, chaka, boom, whole another period of like, it's time to have some psychiatric intervention.
Right.
And so that's, yeah, though there's been other than that, and each one of them were in the past sexually abused, you know, and so, but I'm the one who brings it up.
Right.
Okay.
Right.
You know, she's way uncomfortable for what I'm doing, you know, without them even having to verbalize, okay, because
Obviously, you can feel a change in their
well,
body.
yeah, okay, it's like, that's not right. That's there's something wrong here. You know what I mean? And so then I talk to, each time it was with a minor, you know, then I talk to the parent, and I'm saying, you know, what's going on here, you know, and then I find out what's going on.
At this point in the interrogation, the detective confronts Dr. Nassar with the victim's account of what happened during the exams. Surprisingly, the doctor doesn't deny any of the allegations, but instead continues to explain them away with medical nonsense.
So that's what she filed a report for. So right now what the report is titled, just so you know, is a sexual assault.
Right.
Because that is, like you said, that is how she's feeling. That is what she think happened. That's her perception. Times that she's feeling that you sexually assaulted her throughout the examination.
Okay.
She did say everything that you were telling me is along what she said. Hey, it was a lengthy.
What I tell people is, when you're working on the ribs, okay, I don't like to stand on the side. I do it sideline. Okay, when I do it, I'll be at their head, or I do it sideline.
Okay.
Okay, and I tell people, don't come in this way. That's offensive. Come in this way. Okay, if you come in over their head, that's offensive. You know what I mean? It's just the way that I talk about it. So I actually come off from the side.
Okay.
Okay, and then I'll turn their head and do some work that way with it. But it's the rib cage. You know what I mean? You're going to be on the chest wall. You move the breast down. You move the breast down to get down to the wall. Okay? It's like giving someone a mammogram almost. Okay? And when you do the myofascial, let me see if I've got the. Oh, don't save.
So while you're doing this,
Sure,
are you
sure.
explaining? I mean, you said
I always do.
Okay.
You know, because I have to know if it's making them feel better.
is that you weren't explaining what you were going to do beforehand, so she didn't know what was coming. But that she was very well aware that while you were doing that, you were saying, you know, how does this feel? Does this feel better? And that she was answering, you know, either yes or no.
I don't know if you can tell me that, but did she ever say anything to me?
I'm sorry, I can tell you everything. I
Yeah,
have no
yeah.
problem telling you.
Did she
everything.
say something like, I feel offended, or what are you doing, or can you explain it to me better, and I blew her off?
So what she's saying is that while you were, what she said in her words is massaging her breast, what she said is that at some point she tells you, okay, you don't need to work on my shoulder anymore.
Okay.
I don't need to work on my shoulder. It
Okay.
has like longer term issues and I
Okay.
need more work than that. Do you
Okay.
remember that at all?
I don't remember, honestly.
Okay.
But so did I stop working on her shoulder, or what did I do?
Yes.
Okay, so she said stop working on her shoulder, I stopped working on her shoulder, okay.
Yeah.
So I didn't do anything against her wishes. I mean, right, she said to stop, I stopped, okay.
Perception is that she didn't know that was going to be done,
Okay.
but that there was the communication throughout that,
Okay.
hey, how does this feel? Does
Right.
this feel better? Does this not feel better? And then she said she got to a point where she felt uncomfortable and she thought that it was inappropriate.
Okay.
And it went to the line of being from a medical manipulation
okay.
to being inappropriate, at which time that she had said, hey, I think you've worked on my shoulder enough. I don't
Okay.
need you to work on my shoulder enough.
Okay.
And again, I know you see a lot of patients. I just don't know if, you remember anything specific to that or her
That's what
saying
I'm saying,
that.
that's what I was wondering, but at least I would do, if someone says, okay, I think you've done enough, I stop. You know what I
Right,
mean?
which is what she said you did.
Right, so, okay, go ahead.
So that's the first piece of it. Then she says in the first video that you show me where she's flat on her stomach.
Right.
And then what she says, again, just like you're showing me and you're explaining to me, is that your hand had went in between her butt cheeks.
Right.
And then she said the head went more towards her vagina and the vagina hole.
Well, not.
That's the way she's explaining it to me. So,
Okay.
and again, I'm not using medical terms, I'm using her
That's
terms,
okay.
right?
That's okay.
So what she says that your fingers went by her vagina hole, and
Right.
that she felt again that was a massaging
Right, okay.
nature, and that she felt that had went on for too long, and that you hadn't explained it to her prior to you doing it. So it was unexpected to her that she didn't know that was coming, And then when you were doing it, that she felt like it was not.
Was I talking to her during the time though, like I normally
So
do?
she says, yes, again, that, how does this feel? Does this feel better?
Right.
And she says that initially she says, yes, it does feel better. So you continue.
Right.
And then she says that at some point that she says that she felt that it was hurting. So she says, hey, that hurts. Can you stop? And then you said you stopped at that time again.
Okay. That's what I'm saying. It's an interaction, and I don't know how to say this, but that would be appropriate. It's like, you're working on them, and you're trying to and trying to do the work. You need that feedback from the patient, and I'm getting the feedback, and I'm responsive to the feedback, and I'm talking my way through it, as she said I was. You know what I mean? And so, I might have, I haven't been on the records, but if they, that was my second, third, I don't know, I had seen her before, I know that.
Okay.
So that it might be in the note from before that I explained to her, okay? So if you check the notes, okay, and see, you know what I mean? If there is check the notes and see. You know what I mean? If it's, well, maybe, because sometimes I'll do that. If it's a repeat patient, I don't explain it all over again. Because I explained it the first time. You know what I mean? So that's what I'm saying.
So had you done this type of...
I don't know if I did it on her the first time or not. Okay. What I'm saying is that if that was in my treatment plan, you know what I mean? Like, okay, this is what we're going to do when you come in, this is the process or whatever. I might have explained it to her the first visit. Now make the appointment and come in, you know what I mean? And we'll do the work the second time. So it might have been like, the first time's an initial eval, I might like, okay, this is where I probably will go with this. And I would have explained things in the first visit about what we're going to do the next visit. Okay?
And so then you were trying to schedule a follow-up appointment with her.
Normally I say when I do this, it's like, okay, if they respond well, I'm like, okay, we'll do once a week for like 3 weeks, and then it's like once a week for 3 weeks, and then usually I tell people you're like 80 to 90% better, we'll spread it out, we'll put an appointment out there for a month after that or whatever, to see if you can hold the treatment, you know what I mean? But it's usually like initial appointment and once a week for 3 weeks if this stuff works, you know what I mean? So the manipulations. And so if it hadn't, if there was no benefit from the treatment, she'd have been off. I wouldn't have even had. We're like, okay, you didn't benefit from it. I'm not going to do it again, type deal. Because you see the effect. You know what I mean? It's like, and obviously she must have, like she said, at first it was feeling better. You know what I mean? But then she's processed it. Like, wait a second, okay, so then obviously she felt violated. You know what I mean? But the feedback that I was getting was, okay, she's getting better. That's the way that I was. The communication, reciprocation. That's what I was feeling. Okay. So that's the confusion, I guess, that I'm having is where did I not sense any bodily changes? Because obviously she said, okay, that's good or whatever, and I was done,
Is when you were down, by her vagina, is that something that you remember as far as her saying, that hurts or stop or anything like that?
No, I don't. I'm honest, I don't, you know what I mean? But if she said stop or hurts, I would have stopped and changed. Okay. You know what I mean? That would have been what I should do. So if she said that should have been my response. Okay? So that's hopefully what I did. You know what I mean? So I hope I stopped or made it so it didn't hurt or whatever. So, but it's clear. I mean, it is clear in my mind that obviously I was doing those techniques and trying to explain to her as I'm going through it. And so I'm like, well, obviously, there's going to be a disconnect that occurred, and how come I wasn't aware of that disconnect? That's going to be my big issue that I have to wrestle with, is why didn't I understand that at that time I had a patient feeling that way. As a student, I took Dr. Greenman, who was the guy who, like I said, wrote the book, 20-hour course, comes in from California. She's like 70, 75, and she was an older lady, and she was older than the other two, so she was old. And I finally felt it, and it's because the way that she described it to me, to the class, was that it's a triangle. It's you, the patient, and the spirit above, and it's this triangle pattern, and you have to get into that so that, because you don't want the bad stuff to come back into you, because then you get all bad. You got to be able to pass it. It's this conceptual thing, you know what I mean? So that you're trying to get into, like she was talking about how you can actually unwind them, like if they were in a car accident. As you're going through this, you actually get them into positions that they went through, and as you unwind them, the pain goes away. It's esoteric, it seems strange, but it's bizarre that, that's medical, okay? I mean, like, and literally, I'll go through gyrations with them because I'm actually unwinding them of what pattern built it in. So if they got built in that pattern, if you do a Rubik's Cube, you unwind it the right way, and you solve it in less than a minute, okay? So if you feel the tissues, okay, that was brought down here, then there, and all of a sudden they can release. Like the video showed that girl with the leg thing, you know what I mean? I did the releases, her range of motion doubles. You know what I mean? I can test that stuff beforehand, like I was showing with the girl sitting. I put my hand on her bum, pain goes away, no, pain's still there. I change my hand, pain's gone now. Okay, I know that that's then the angle or the vector that I need to do to, did I somehow, I obviously must have to her, reached the line where I was feeling connected, like, you know what I mean? Did I get into it too much? Did I feel like, there it goes, you know what I mean? And you just ride the body rhythms. It's hard to describe, but it's what osteopathic myofascial release is about, okay? And it's unwinding. Okay, you can write that. I don't use that word, but that's a medical term for myofascial. It's unwinding. You unwind them.
I mean, I'm just going to go through this. I'm pretty sure I've covered everything with you that I want to cover. I just want to make sure I haven't missed anything that she said, because I'm not going to hide anything from you. I'm not going to keep any secrets.
And it's
right. Obviously, it's your whole profession. It's about who you are.
It's not even the profession. It's who me. You know what I mean? Like there's such an important trust, and to feel that I violated that with someone, that the sexual stuff for it's the trust. That's the hard part for me. Okay, because that's the whole thing. Sorry.
No, you're okay.
To break someone's trust, that irritates me. Okay, sorry.
No, you're fine.
What I always tell people is you can't get that back. You know what I mean? That's the one. You honor that. You respect that. That is the vital thing, okay? And somehow or other, that hurts. That hurts. I don't know. Okay, but sorry.
No, you're perfectly fine. I'm sure if I put myself in your shoes, it's weighing pretty heavy on you all the way around for a multitude of reasons. There are only a few minor places where you guys kind of split the road there. Everything you're telling me is everything she told me. So it's not like she's telling me anything else, okay? So what you're saying that you would have done is what she's saying you did.
Okay.
Again, what we're looking at is maybe perceptions, misperceptions, that she felt that she didn't know what was coming or what was going to be done for explanation purposes. And again, this is what she's saying.
Right, I totally understand.
But what she's saying happened is exactly what you're saying happened.
The launch of the MSU investigation was a promising sign, and victims anticipated that Amanda's case might finally be the end of Dr. Nassar's reign. But their hopes were dashed when, true to pattern, the university sided with Dr. Nassar and deemed the exams medically appropriate. For the third time, a victim's cry for help was dismissed by MSU, but hope was restored a year later, when Maggie Nichols wrote the letter to U.S. Gymnastics that got the FBI involved. Maggie's report would ultimately be the beginning of the end for Dr. Nassar, as news outlets also began looking into the long pattern of complaints USA Gymnastics had received in recent years and their poor handling of those complaints. This widely publicized investigation is what finally prompted two women, Kyle Stevens and 31-year-old Rachel Denelander, to go to the media and be the first victims to publicly denounce Larry and expose him for the predator he was. Both former gymnasts were allegedly assaulted throughout the year 2000 when they were 15 years old. In response to what was now a nationwide call for justice, Dr. Nassar was brought in for questioning once again, and this time, he'd have to answer for more heinous crimes than the first interview.
Sorry.
I'm Andrew Munford.
Hi, nice to meet you, Larry. Yes, sir.
Thanks for coming in so quick too.
Yeah.
Obviously you're not under arrest, so you can leave whenever you want. What I want to talk to you is kind of go back to that situation. And I know that you guys had, sorry, papers all over, talked about maybe redoing some practices and things in relation to that. Reference that situation. What do you recall about that investigation?
Right, that had, concerns over the form of treatment that I was doing, and that I talked about having to do the reasons why I did it, from a manual medicine standpoint. And there was a student that was in the room that had to leave to start because I was behind. We need to start another patient. And so we're like, always have another person in the room.
Right.
You know what I mean? And I've been trying to adapt my techniques so we won't get into the same situation.
Okay. What practices have you changed in response to
I've been trying to have people in the room,
Okay.
And trying obviously not to get into that same situation. You know what I mean? Like, has there been another complaint? I'm just like confused right now.
Well, we're kind of seeing what things have changed, what practices.
Okay, yeah. So I'm trying to do things where the difficulty is with the hands-on is I'm trying very hard to do things where I'm not being nearly as invasive, but it compromises things. So I am trying to modify that and having students there and having family members there, and I document in the chart, so-and-so's in the room, you know what I mean? So my documentation's changed. I'm trying my best to do it over close, and that's sometimes the hard thing is the tightness, you know what I mean? It's like the close gets in the way, But so I'm very, there's not a day that goes by that I don't think about that, you know what I mean?
Yeah.
Because that was a very scary thing, in my life, obviously.
Have you had any instances where there hasn't been anyone in the room for an exam since that time?
There'd be some on occasion, of course. You know what I
Okay.
mean? That just is the way that with medicine is now. It's difficult. You know what I mean? So yes, that has happened.
In what circumstances caused that to happen?
The patient is an adult, like she was too. But again, when I'm doing that, I'm trying not to do those techniques. You know what I mean? So, but I'm trying, really trying to explain things. And I haven't had any complaints, you know what I mean?
During that technique, though, has there been situations where someone's not in the room?
I would probably, who's a doctor, you know what I mean?
You do that technique on.
She said it saved her career, you know what I mean? So she was just in today.
Can you explain the technique? I know bits and pieces,
So,
but I'm not
and I
super
sent her
familiar.
videos, you know, too. I mean, like
Yeah.
I lecture on tuberous ligaments. It runs from the pubic symphysis, the falciform process. It's like the pelvic floor. Okay, you want to understand that stuff. So you're really coming in, and like the way to describe it, even in some of the videos is, it's like you go towards the labia and go lateral. So you're going in and apart. Okay, and then there's muscles that attach to the ligament, and so as you're treating that, you can feel the release, and that's a great teaching thing too. It's like I have the student feel their rib cage, okay? And then I go and I release that, and they're like, oh my God, what did you just do? You know what I mean? Because they can feel that effect, from the way that the muscle, the costostoracic runs down from the rib cage into and entwined in the sacrotuberous ligament,
So when you're doing that, and you said you look for the release, what are you feeling? Like what does?
You feel tissue tension.
Okay.
Tissue tension changes. It's all about tissue tension.
Right.
And so you're trying to, like if I pull on one part, you know what I mean, like you can see how that affects another part.
Right.
So it's the same thing like a run in the pantyhose or something like that. Like one pull here can affect, and we talk about triplaning and fascial releases where, say if I rotate, extend, and back, you know what I mean, that like wringing out a towel, you know what I mean? So there's, you may have to go clockwise, counterclockwise. I always talk about the different vector forces to make the effect above, you know what I mean? So it's a three-dimensional, I call it triplane, but like a three-dimensional effect to it, because it's not just that.
How long have you been doing this technique?
I have video from 30 pounds ago, from like the 1990s. I'm trying to remember. It would have been in the 1990s, you know what I mean, like early 1990s.
Right.
And I've made videos very clear, you know what I mean? And I've lectured, and I've lectured.
Are those online anywhere?
They're on my G drive. Like,
So how would a patient be laying to get that treatment?
Prone, and then they're lay prone, you know, and then you're doing that. And then I can do it seated. I talk about doing seated. I can do it standing. I can do it supine. So, yeah, you can do, but
Would they be on their side?
on their side?
Yeah.
Yeah, you can do it on the side, too. I mean, like, I show them in all the different directions, but it's rarely on the side. It's more, if I'm doing something on the side, that's more for the SI joint. That's the SI joint.
So where on their body would you touch
Your
them on
ear
the
would
other side?
be, if your hands are like this, you know what I mean? You could be actually holding that, like, this would be up towards the back, and this would be up towards the pubic symphysis, and you would could be like a U shape, and you can lift and shift from that position on the sideline. Generally, with the sideline, that's the lift and shift, and the coccyx. You know, if there's a coccygynia, you know, problem, then sideline. I teach them, if it works, I've taught a lot of patients how to do it themselves.
Okay.
You know, I mean, like self-treatment, like, okay, I told them it's like giving themselves a hand wedgie. You know, it's like reach and pull, like you're picking a wedgie, you grab, and then you pull off to the side, or you pull front, or, you know, one of those three main vector forces is.
Okay. Would this ever involve, like, digital anal penetration?
Only if we're doing a coccyx, you know,
Right.
problem. You know what I mean? So if there's a fractured coccyx or a, you know, a coccyx disorder.
Dr. Nassar has essentially just admitted to taking advantage of not just fit young athletes, but patients suffering from debilitating injuries and disorders. But the true depths of his depravity have yet to be revealed.
Well, the reason I'm asking is that we did have another complaint.
Really?
Yeah. And it's a patient from a while ago.
Okay.
And she does describe some things that sound to me like they're out of the norm
Okay.
from your typical treatment.
Okay.
This would have been in,
Wow. Okay.
and she was receiving some of that type of treatment, but then
Okay.
there were also some other ways that she was touched that she
Okay.
would be on the treatment.
Okay.
So that's why I'm asking about anal penetration.
Only if there'd been coccyx, and I would have, and it would have been, I mean, like, because you can push hard. There's a lot of room down there, but I wouldn't have gone intra-rectal. You know what I mean? Like, unless I was purposefully treating the coccyx itself.
Okay. Used to do that, like what digit or what part of your hand would you use?
Well, normally I'm using my thumbs, you know, as
Okay.
I'm coming up this way. You know what I mean? Then if I actually have to fix a coccyx, then I'm going to be using my finger inside and my thumb on the outside.
Okay.
You know, to
Do you wear
manipulate
gloves
the
when you do
coccyx.
this?
If I'm going to go intra, yes. You know what I mean? You know, so.
This was a long time ago, so I don't know how many of your patients that you remember from back
Right.
then.
Yeah, I don't, I mean, you know, how many patients,
Mhm.
right. Yeah, no, I
This is a little bit of a personal question, so
Yeah.
I'll just be totally honest.
Yeah.
I mean, you have these young girls in there. They're
Right.
athletes.
right, but they're usually with their parents. They're usually with
Yeah.
their, you know, parents, you know. So that's why I explain a lot. You know what I
They're
mean?
athletes. They have
Right.
lovely figures.
Right,
They're very
right.
cute girls.
Right.
Do you ever get aroused during these exams?
Do I get aroused during the exam?
Yeah, like do you ever get an erection?
Well,
Or, I mean,
obviously you don't, you know what I mean? So
is there a reason that you would during an exam?
I shouldn't be getting an erection during an exam.
Right.
Okay.
Well, this is why I'm talking about this,
Yeah.
because this young girl and her mother both observed this on more than one occasion during treatment.
That I would get aroused during an exam.
Visibly an erect penis. Not exposed, but through your clothes.
I can't explain that because that should, when I'm working, I'm working.
Mhm.
You know what I mean? So I don't.
Well, you can understand why this would be
Well, yeah.
a concern.
Yeah.
You know, that you didn't wear gloves.
Right. Okay. But I mean, but it was like doing her coccyx.
Mm-hmm.
Actually digitalize the coccyx, like for coccyx treatment.
The words that she used were he anally penetrated me with his thumb.
No, see that wouldn't have been. See, I would never do that for the coccyx. I would use if I'm going inside, I'm using this. If I'm penetrating, it's not penetrating. It's pushing off to the side.
Again, this was some time ago.
Yeah, but I'm lifting up and I mean it's not going inside a rectum. It's lift. You can get there's a lot of soft tissue there, you know, and you're lifting through there. I would be wearing gloves if and I would be using this finger. Okay, when I'm using my thumbs, I'm lifting, you know what I mean, to try and separate the tissue and releasing through there. You know,
And this is what you're describing to me is very different than how she's describing her experience.
Okay.
All right?
Okay.
That
But
there
I'm
was no
trying to
explanation of what you were doing to her or to her mother. And so you can see kind of the consistency
Well, yeah.
from what happened a couple years ago.
Well, no, but okay, but I mean, okay, I'm and stuff. I mean, that's what I'm known for is my education. You know what I mean? So I don't.
Your education to
students.
To students,
Right.
but not necessarily
To patients. Well, I try to. I've never had anyone, you know, what's confusing me about is why wasn't there anything said back when I was treating them if they felt that uncomfortable? You know what I mean? It's like if I'm talking to the patient.
Okay, put yourself being a teenage girl.
Okay.
All right.
Okay.
Most people that are sexually assaulted
Uh-huh.
are very uncomfortable. They don't know what to say.
The parent was right there. You said the mom was there?
She was in a different part of the room. She couldn't
It's
observe.
a long time ago, you know, I mean, for me to remember everything, but there would be, like I said, what the discrepancy would be is I'm using my thumbs, that's not a discrepancy, to release around the coccyx, okay, where I'm actually lifting, okay, so that's what I said, if I'm treating through sacrotuberous and not the actual, because I'm trying to release the tissues that come up to attach there, so I am pushing hard, okay, with my thumbs, okay, and I'm separating. Okay, so if you have thumbs over there and you're separating, but I'm not going in, if you're going inside you're going to be using your finger, okay, not your thumbs, and that's consistent with what I'm saying with what she said. So if I'm saying yes, that I'd be using my thumbs, how's that inconsistent?
Well, if your fingers and pardon me, gesturing are doing some type of.
But my fingers are up here. My thumbs are at the coccyx.
Well, that's not how she's describing it. Now, your fingers are vaginally penetrating her.
What?
And then your thumb
Uh-huh.
anally penetrated her.
No.
So I don't see where that falls in line with that technique.
Right, and I don't see how that would be accurate.
More than once. More than one treatment.
I'm just working the floor, you know what I mean? But I would not be. How would I be putting my thumb and fingers, you know, like that? That would not be correct, you know.
Now, if there's some type of treatment where she's on her side, would you have any reason to touch her breast?
If I'm treating ribs, so if I'm treating ribs, that must have been, like I said, I would have been pushing and touching ribs, okay?
How would you touch her breast to do the ribs? I mean, demonstrate on yourself.
Right, you're moving the tissue out of the way. You're moving the tissue out of the way to try and get down between the breast and the rib. Ribs that are underneath that area, so you're trying to slide through and across.
I get that makes sense.
Right.
But this girl saw you 5 times, and all 5 times there was something that, with her knowledge of what that treatment was, because she had some knowledge of it, went beyond that. The touching of her, the digital penetration of her anus, touching of her boob, and she could visibly see at that time that you had an erection, that you were aroused. Okay, she describes your demeanor, your behavior, your physical reactions, and being able to see an erection. Okay. So, you know, I know it was a long time ago.
Right.
I'm here to get your side of the story because this is very concerning.
Well, yeah. I mean, I try my best to be appropriate, professional, you know what I mean? And
Unlike the interrogation 2 years prior, where the doctor had an answer for everything, this time around he seems more at a loss for words. He's clearly uncomfortable with the very direct line of questioning and the detective's no-bullshit demeanor, and with no demonstration videos to rely on, he's going to have to justify his heinous actions without the assistance of fancy diagrams.
Has it ever happened in an exam or treatment before?
you know, I mean, you are, you know, I mean, I'm focused on my treatment. You know, I mean, I'm not trying to gain any type of sexual pleasure out of working with my patients. Okay, I mean, that's what you're trying to ensue or whatever.
That's what I'm asking you.
Right, and I'm saying no, I don't get sexual pleasure out of working with my patients. That's not what being a physician is. Not what I'm about. Okay, what I'm trying to do is release tissue and work through them, but I'm not trying to get my, you know, like my jollies out of this. Okay.
Explain to me, like, when you're doing an exam, is it physically taxing on you?
Yes. Oh, yeah. Any medicine is physically taxing, yes. You know what I mean? That is, there is no question about that. And yes, you're moving tissue out of the way. You're pushing in and separating, okay? And you're trying to feel with one hand you're pushing, with the other hand you're monitoring to sense what's happening at the other end, and then you can compress and mobilize. But I mean, so I could see how people could feel, because there's a lot of tissue and I'm separating, but I'm trying to explain things while I'm doing things.
Someone that you trust, and
Right.
all of a sudden, his fingers are essentially in your vagina,
What?
and with
Right.
no explanation.
I would have explained it. I don't understand why she said I didn't explain it, because I always explain, okay, now you're going to
But
feel
you
like
didn't
pressure.
explain it 2 years ago.
Yes, I did.
I mean, 2 years ago, she reported pretty quickly after it happened. She's not going to forget
Right,
that she
right,
received
right.
an
But-
explanation.
But I do explain. You know what I mean? That's what I'm saying is like, I don't, that's I'm like, okay, I'm putting pressure, compressing, separating, you know what I mean? Like I'm going to, my hands are going to be pressing on you here, and I'm going to be pushing off to the side, or, if this hurts, let me know, but I'm treating it and just talking at the same time. As I'm doing it, like, does this hurt? Are you okay? Is that feeling better? Okay, so it's not like it's a dead silence and I'm just doing things. You know what I mean? I'm constantly talking, with.
Would there be a situation that you wouldn't wear gloves during an exam like that?
If I'm, I will wear gloves if I'm actually like manipulating the coccyx. You know what I mean? Because you're going into rectal. You know what I mean?
What if you're going vaginally or even just outside?
Well, if I'm just outside, no. You know what I mean? Yeah, I even say that on the thing, as long as you're staying external, you know what I mean? Because you're external, okay? And you're sensing, you're using to push, to lift and shift, because you're staying, you know what I mean? Like you're staying lateral to that. So you're pushing in central and then lateral, okay? So, but so if you have like the vagina here and you come in here pushing, you can see how you could, like feel, or they may have, as a teenager, having that sensation, but I'm not going intravaginally. I'm going extravaginally, but pushing in through the pelvic floor, okay? So this is the pelvic floor, you know what I mean? You're here and coming over. There's tons of room there, okay? And so that's what I'm saying is like, that as I'm doing that, I'm asking them, are you okay? Am I pushing too hard? Is this hurting? You know what I mean? Do you feel better up there? Am I monitoring hand?
Do you ever ask them if it feels good?
Feel better or worse? You know what I mean? Does that feel better? You know what I mean? Are you doing okay? It's always better, because I'm trying to see, okay, do I need, remember I said about the different adjustments, because do I need to go this way, or that way? It's based upon how they're responding and how I'm sensing the release, because I can sense the release, but I can't sense their pain. That's the thing that's very irritating to me, is that if I'm asking the patient, for feedback while I'm doing it, that's how I always feel like I'm okay, because I'm like, are you okay? Are you okay? Like you're talking in real time. But that's what is frustrating to me, is trying to get an understanding of why there was that lack of communication.
Fear?
But when you're talking to them in real time, you know what I mean? Like I'm asking their feedback.
But in a situation where you weren't talking and they didn't know what you were going to do to them because they had no prior explanation, I mean, would a girl that young speak up?
When you're trying,
If she's
I'm
wondering
trying.
if she's not feeling okay, but she thinks it should be okay, and thinking about it later, then she realizes that it was not okay with her. I mean, there's lots of reasons why people don't speak up.
I can see that,
And then seeing that you're erect and feeling on more than one occasion and feeling very uncomfortable.
Yeah, well, it'd be nice if I had, whatever. I mean, I can't speak for her, but if the parent also and her felt that, it'd be nice if there was some communication where I'm asking for communication. You know what I mean? So, but that's.
We can't go back to having that.
Right.
But this situation as it is, I mean, there are some things that, even to me, hearing you explain it one way and hearing how she explained receiving the treatment,
Right.
very different.
I mean, trying to explain it, I mean, the best that I can.
Right.
I mean, I'm trying.
But for her, she very vividly, you've done it hundreds, maybe
Right,
thousands
right,
of times.
right.
Her, she did it 5 times, and it's very vivid to her
Okay.
how she received
The
what you
treatment.
presented as treatment, what
Uh-huh.
she felt very different as.
The last thing I want to do is hurt someone.
Mm-hmm.
You know what I mean? And so if you're concerned because you're in their private area and you're asking them questions, and if they're not giving you the feedback, then how do you know that if you're saying, am I hurting you? And they say no, then how do I know that I'm hurting them? You know what I mean? And I'm trying to be realistic with them. You know what I mean?
And I understand that in a treatment, but in a different situation, and I think what concerns me here is the visible signs of your arousal, where this young girl is afraid.
Right. Well, I don't want people to be afraid, obviously. And I was trying to, with my patients, I'm trying to actually help them, not hurt them. Okay? You know what I mean? That's the bottom line, I guess you could say. You know what I mean? Is that's my goal.
Just to clarify, you're saying that during these treatments where you're dealing with young to old teenage girls who are very physically fit, very attractive,
Right.
that you don't get aroused when you're
Well,
touching. I mean, you're essentially touching their genitalia,
Right,
touching their breasts and certain treatments.
I'm not purposely trying to get arousal from doing any treatment. I mean, come on. You know what I mean? I'm not purposely trying to gain some type of sexual gratification out of doing that. That's not what I'm doing. Okay? If there was arousal, it's I mean, like, it would be because of whatever, I don't know, but I'm not trying to,
I don't know. I don't know.
When you're a guy, sometimes you get an erection, you know what I mean, but I don't, that's
Well, you
what I'm
get an
saying,
erection when you're aroused.
but you know what I mean, like, I'm just saying that, I'm not trying to, how do you say this, and if I had an erection, I understand why I would have an erection from doing the treatment, you know what I mean, from what I'm doing, okay? And that's rather embarrassing, you know what I mean? It'd be rather embarrassing, okay? I mean, to have that happen, okay? So it's just like, that's not appropriate, okay? And that is just not professional, you know what I mean? I don't know how else to explain it, but that's, yes, you're a guy, but I'm trying to not, and yes, they're young ladies, but I'm trying my best to be professional, you know what I mean? That's why I'm talking with them too, is I want that feedback, I need that feedback, because if I don't, then how do I know that I'm, if I'm in their area and I'm talking to them and asking them, you know what I mean? It's constantly asking them, you know what I mean? Like, then I feel like, okay, they're giving me the positive feedback. If they're not, I adjust, okay?
I understand what you're saying about the feedback, but I think there's a difference between like physically hurting someone and then them feeling touched inappropriately.
Right, but
And I think that's a different scenario of a comfort level to give feedback.
But that's hurting, though. I mean, but that's hurting. I mean, like, if you're doing something inappropriate, that's hurting. That's not helping. You know what I mean?
Well, hurting mentally. But it may not be causing them physical pain to give you physical pain feedback.
Yeah, I mean, but there's a comfort level. If you're doing something and you're asking them.
Have you ever had someone do something that made you feel uncomfortable and you doubted saying anything?
Not, like you mean like.
Anything. It doesn't have to be physically anything. Where you thought, I don't feel right about this.
Yeah,
I don't know what I
you
should
get your
say.
gut feeling. Yeah. I see what you're saying.
And your instinct was probably correct.
Your gut. Well.
Dr. Nassar shamelessly ends the interrogation without a confession, but rather with questions about what is going to happen to him in his career.
I was going to give you a business card, and I realized that I don't have it. I'm going to go grab one and give you a moment to think and see if you have any other questions for me.
Yeah, I want to know what's going to happen. You know what I mean? Like I'm very.
I think similar to last time, obviously the university has to be notified. I have no control over that.
Right.
So I'm sure there will be conversations with your dean or whoever, however that looks. I'm sure you're familiar with that process. We don't get super involved in those processes, but and then I will continue to investigate.
Okay.
There will be other witnesses to talk to, things like that.
Okay.
And so, like last time, there will be an investigation.
Right,
Okay?
okay,
All right, I'm gonna go grab a card, just so that you can have my information. I'll be right back.
okay.
Read over their business cards. So before I forget, I'll give you one of those as my email,
Okay.
and also the phone number that I left for you.
I don't know how to explain it more than what, you know, I mean, like, you know, I can't go back in time and remember that far, okay? But I'm telling you, honestly, you know, it is, I'm trying my best to help the patient. I'm trying to get real-time feedback from them, okay? And I've helped so many people, you know, it hurts my brain to think that someone would, as I'm talking to them, I just don't get it, because I'm trying to prevent that. I don't want to hurt someone, so I'm trying to get real time. Am I helping? Am I not helping? And I try and adjust based upon what they're saying. And so it's hurtful for me to think that I've hurt someone. You know what I mean? That's just not who I am. Okay, and I'm trying my best to figure out how I didn't read the situations, you know, because that's, you know, I mean, you're trying to assess comfort level, you know, too, and I obviously offended her, you know, I mean, there's no question, and that's not good, you know what I mean? And
There may possibly be other complaints.
I mean, I'm doing this treatment a lot, you know what I mean? So, you know what I mean?
But why would there be those consistent complaints?
You work down there a lot, you know what I mean? If I'm working there a lot, okay, what's gonna...
But if repeated girls are saying that you're not explaining the process and that...
But I feel I'm explaining the process. They may not be understanding it, but I think I was explaining the process. You know what I mean? Like if I'm explaining it and they're not understanding it, then you would expect that they ask for more information.
Have you had other complaints from patients?
No, just the one. You know, but you know, if I've had to explain things to patients. You know what I mean? Like, but.
But if they afterwards said, "I feel like you invaded my space, that I violated,"
no, nothing like that.
Okay. About how many times do you think you've done this procedure?
It'd be thousands, you know, over the years, because it's been a long time.
Are you in contact with a lot of your patients after
A
treatment?
lot of my patients, yeah, you know what I mean, over the years, because they'll come back, you know, I'll see them again, and for a different injury, or, you know what I mean, yeah.
Do you initiate a lot of the contact with them?
No, I never initiate, they initiate the contact.
Okay. I don't really have any other questions right now.
Okay.
What's the best number to call you if I need
Let me
to?
give you my cell.
On September 20th, 2016, a search warrant was authorized and executed on Dr. Nassar's home. Detectives didn't know it at the time, but their timing was spot on, because outside of Larry's home sat a full garbage can that was waiting to be taken away, and inside one of the garbage bags were 4 hard drives. The drives were taken to the police station with the rest of the evidence and later examined by the computer forensics unit. On just one of the drives was over 37,000 images and videos of child pornography, some featuring girls as young as 6 years old. These findings were subsequently reported to MSU, and finally, after allowing countless student athletes to be traumatized and mistreated, Larry was fired from MSU. And once the floodgates were open, hundreds of other victims steadily came forward, including past and present MSU students, U.S. national team gymnasts, and members of Twistar's gym. Even world-famous Olympians Simone Biles, Aly Raisman, and Michaela Maroney weren't able to escape his abuse. On November 22, 2016, 2 months after departing MSU and 19 years after his first reported assault in 1998, the law finally came for Larry, and he was arrested for 3 counts of first-degree criminal conduct with a person under 13. Around the time of his arrest, police officials announced that Larry was facing around 50 complaints of misconduct, but that was just the tip of the iceberg. In December of 2016, he was also indicted on federal child pornography charges in connection to the footage found on the hard drives. But the biggest hit came on January 10, 2017, when 18 victims got together and filed a massive federal lawsuit lawsuit against Larry, MSU, USA Gymnastics, and Twistar Gymnastics Club. Larry pleaded guilty to the pornography charges on July 11, 2017, and was sentenced to 60 years in prison. On November 22nd, he pleaded guilty to 7 counts of first-degree criminal conduct as part of a plea deal, which included not adding on any subsequent SA charges for victims that might come forward in the future. For those charges, he received a sentence of 40 to 175 years. In February of 2018, Larry pleaded guilty to 3 counts of criminal misconduct in a different county, one victim being under the age of 13. For that, he was sentenced to another 40 to 175 years. And as for the lawsuit, MSU reached a $500 million settlement with a total of 332 victims on March 16, 2018. But while that was going on, Larry was sitting in U.S. Penitentiary, Coleman II, where, unbeknownst to him, inmates were plotting to end his life. On June 9, 2023, he was found by prison guards with multiple stab wounds to his chest and back and was rushed to the hospital in critical condition. Larry ultimately survived the attack and was last listed as being in stable condition.